Anne and Katie here at Radiance to answer commonly asked questions about laser vein treatments. So, I have these small red vessels on my face and maybe around my nose here. Can those be treated?
Absolutely. The small red vessels on the face, we often see them in the nose or even on the cheeks. They can be treated with a laser or IPL treatment.
So, how does a laser vein treatment work?
Sure. You can use a laser or IPL device to target the small red vessels on the face. The heat from the device targets the vessel. The vessel absorbs that heat and it reduces the appearance of redness and the actual vein.
If I have redness or vessels on my face, can they be treated safely?
Yeah, it is safe. The treatment is very safe and this skin condition is not harmful to your health. However, many of us just don't like the look and therefore it can have a more psychological effect on us.
Is there any downtime after this treatment?
The skin can be pink after the treatment for a few hours. Technically, there is no social downtime after these types of treatments, but this can vary.
So how many treatments might I expect to have to help this redness or these vessels?
Sure. This can vary from person to person, but normally we'll start people with a series of 3 to 4 treatments spaced about 1 month apart. After the initial treatments are complete, you can expect to need maintenance treatments every 6 to 12 months, and this will just depend on your lifestyle.
So what can I do to sustain the results of my treatment so maybe I don't have to have them as frequently?
Sure. Avoiding hot tubs, saunas, maintaining a healthy lifestyle, and protecting your skin with professional grade skincare products, as well as using a zinc-based sunscreen every single day.
So if you have further questions about laser vein treatments, you can schedule a consultation with one of our providers to learn more.